Right now, though, it's time for our Bronson Med Chant. We're going to talk about something that really has, it would be, Stacey, you'd think it'd be a common sense approach, but I don't know if people are totally using common sense a whole lot sometimes. Joining us is Stacey Reinoehl. She is a cardiac nurse navigator at Bronson. Now, what this is she helps guide cardiac surgery patients through their entire experience and then navigate their individual plan of care. So welcome. It's nice to have you here.
Good morning. Thanks for having me.
So we're going to talk about, like I said, common sense. There hasn't been a real definitive link between stress and heart disease. However, I think a lot of people know that stressful situations aren't good for the ticker. So we're going to talk a little bit about that. The one thing, though, that we probably ought to talk a little about first is, what is heart disease?
Well, that's a good question because heart disease is really a very broad term. But when we're talking about heart disease in this country, we're talking about cholesterol buildup in the coronary arteries. So those are the vessels that supply blood and oxygen to the heart. And if those are blocked, that can lead to a heart attack.
So we're talking about cholesterol and things like that. Do some of these things have to do with unhealthy lifestyle, choices? And if so, what are some of those choices we make?
Absolutely. So we talk about those choices that we make when we're stressed. When we get stressed, we don't always make the most healthy choices, and sometimes we tend to choose those things that may seem like they make us feel better immediately, but really in the long run, they can hurt us and they can hurt our heart. So smoking, excessive alcohol, eating junk food, not exercising, those are just a few.
Yeah, I was going to say, I've heard, many occasions if people get stressed, they do things, they eat food they're not supposed to eat. They don't sleep very well because they're worried about things. So yeah, I can see where that, at least those two things would have an issue. All right. So we're talking about, the stress level that people have. How important is it for, we'll talk to the younger generation, I guess, to be mindful of, how their behavior can impact their heart down the line?
Absolutely. When you're younger, you have more time to help build those healthy habits. So it's extremely important for the younger generation to educate themselves about what they can do to reduce the risk of heart disease. So making those wise choices and building healthy habits early will definitely help you down the line.
Stacey Reinoehl talking with us. She is a cardiac nurse navigator at Bronson. All right, so what are some easy ways, Stacey, that people can use to reduce their stress level?
So reducing stress is almost a misnomer because we can't always control those things in our lives. We can't always control things that other people do, but what we can do is control our response to stress. So we can manage our stress response, and exercise is one of the easiest. Not only does exercise help us increase those feel-good chemicals, it also helps us get rid of all the stress chemicals. So, and along with that, deep breathing exercises in the form of, yoga, meditation, or just consciously taking deep breathing. Those are all proven ways to help manage stress.
So now is this keeping yourself out of stressful situations? I imagine. Sometimes you might not be able to, but for those stressful situations that are preventable, it's probably a good idea to stay away.
Absolutely. If it's possible, identifying those things that in your life cause you more stress and making those choices to either modify those or remove them.
One of the things, obviously, when you're talking heart disease, genetics, or heredity, has a lot to do with it. But I know that I had my doctor tell me this. He says there's a lot of people walking around on the face of the earth that have no clue that they possibly might have heart disease. And he also told me, he says, unfortunately, in some cases, the first symptom of heart disease is could be death at that matter, or a heart attack or something along those lines. So if you are listening and you're thinking, I know I have stress, but overall, what do you do to find out if you're at risk for heart disease?
So one of the things, if you're interested in finding out more information, is you can visit our online health risk assessment at www.bronsonhealth.com or www.learnyourrisk.com and take a risk assessment. And we're always available at our Bronson Health Answers at 341-7723.
And they should probably use their primary care physician too as a sounding board. I mean, kind of what that person's there for. But if they have any questions, say, hey, look, I'm this age, or I just think that maybe I should because your primary care physician can help guide you in that direction too as well.
Absolutely. They're one of the best resources that we have, and they can help guide you in helping make those what we call modifiable risk factors, those choices. So they can help with different support and things, and they can also keep you on that right plan, that right path.
Now, Stacey, if someone goes to learnyourrisk.com, you get that tailored report, what happens if they end up being a high-risk patient?
Well, there's some options there. It'll explain and walk you through it at the end of the report, and then we're always available as well, and the contact information for health answers, and we have different screening opportunities as well.
All right, and if you want more information about heart and vascular care at Bronson, where can you go?
www.bronsonhealth.com.